This video tutorial is going to show you how to enter a long-term home health review into EQ Suite. When you log into EQ Suite, you will see a menu bar of options at the top of your screen. To start a new review, you will always click on Create New Review. When you click on Create New Review, your requesting provider ID information and name will automatically be generated into the field. You will then be prompted to enter if you are the billing provider. If you are the billing provider, you will click on Yes, and the billing provider ID field will automatically generate with your information. If you are not the billing provider, then you would select No, and you would be prompted to enter the Medicaid ID number for the billing provider. Once you've entered the billing provider's information, you will then move forward to select the review type. When you select the review type, you will have 4 options to select from. For a new authorization request, you will select the review type as admission. Once you select admission, you do not need to enter a PAR number because you do not have a PAR number as it is a new request. Once you select admission, then you will proceed with selecting or clicking on Retrieve Data. When you click on Retrieve Data, you will then be prompted to enter the client's ID. Once you enter this information, you can hit Enter or Tab into your computer, and once you do that, the patient's name, date of birth, and gender will automatically generate. Once you've entered the patient's information, you will then move forward to enter the physician's and healthcare practitioner's information. The only required field in this area is the ordering provider that's in bold. To edit this information, you will click on the Edit button, and then you will enter the Medicaid ID number for the ordering provider. If you do not have the Medicaid ID number, you do have the option to search. If you click on the search button, you can enter either an NPI or the last name of the physician. Once you enter that information, you can click on the search tab, and then you will select the correct physician for this request. You do want to make sure that you select the correct physician because sometimes there may be more than one physician with the same name, and you can do that by checking the phone and address for that provider. Once you find the correct physician, you just click on Select, and the physician's information will automatically generate into the field. If something needs to be changed or added, you can do that by entering that into the following fields. And once you enter the information, you can click on the box below that says you verified the information is correct. And once you check that box, you will click on Update. Once you've entered the ordering provider's information, the next field that you will enter is going to be to select the type of request as either urgent or non-urgent. Once you select the type of request, your next field that you will enter will be the start of care, or when you plan to start services. For long-term home health requests, you can request up to 365 days. If you need to calculate the date range for that time frame, you can click on the menu tab at the top that says Utilities and the drop-down that says Date Calculator. Once you click on the Date Calculator, you can enter your start date of services and put in the number of days that you're requesting. Once you do that, you will click on Calculate End Date, and it will give you the proposed discharge date for your request. You do not need to enter an actual discharge date. That would only apply to services that have already been completed and rendered. The next field that you will enter is going to be the intended place of service, and you will choose from the following drop-down of options. Next, you will identify if this is an untimely PAR. You need to explain why on the Summary tab. And then you will click on Check Key. Check Key will go through all of the fields that are on the Start tab to make sure that you've answered all of the questions and that there are no errors. If there are any errors or some fields were left incomplete, you can go ahead and click on the Errors box, and it will tell you what needs to be corrected. Once you've corrected those errors, then you can go ahead and click on Check Key again, and it will go through the fields to make sure everything was completed and corrected. If everything is complete, it will take you to the next tab, which is the DX Code/Items tab, and this is where you will enter the diagnosis code and the CPT code for your request. To enter the diagnosis code, you will click on the first Add button, and you want to make sure that when you enter this information that you do not use any decimal points. If you do add a decimal point, it will give you an invalid error code message. So just make sure to remove the decimal and you hit add or enter on your computer, and the description of that code will generate. The date identified will automatically generate to the start date of services that you entered on the Start tab. And once you've entered the diagnosis, you will just click on Add, and then the box will go clear out and you will see that the diagnosis has been added in the background. If you need to enter additional diagnosis codes, you can go ahead and do that, and if you're closed, then you can go ahead and close out of the box. You will then enter your plan of care start date and end date. This should match the same dates of service that you entered on your Start tab. Once you've entered that information, the next Add button is going to be where you enter the CPT code. Once you enter the CPT code, you will hit Enter or Tab into your computer, and the description of that code will generate. A reminder, your from and through date will match your authorization date span that you're requesting. So it should match the exact dates for your plan of care start and end date as well. Once you've entered the from and through date, then you will proceed with entering the visits and periods, the period type, and the number of periods you're requesting. Remember, for the CPT code 571, the first 60 minutes of care, you will use that for the first 60 minutes of care. For the CPT code of 579, that is used for each subsequent 30-minute period provided during the same visit. The number of periods will reflect how many visits that will fall within the date range that you entered. So for example, if you choose the period type as day and you're requesting 365 days, then you would enter 365, and then the total number of units will automatically calculate. Once you've done that, you will click on Add. The box will clear out, but you will see that the code has been added in the background. And if you need to enter additional codes, then you can go ahead and do that at that time. Once you've completed entering your CPT codes, you can close out of the box. If for some reason you are not able to complete the review at this time, you do have the option to partially save the record. If you do click on partially save, then the review, it will generate a review ID number. And then you can go into EQ Suite at a later time, click on the search tab, and you will be able to find that review and open it to complete it. If you are ready to complete your review, then you will go ahead and click on Continue, and the next tab will generate. Now, for a long-term home health request, the only other tabs that are going to be required for you to complete is going to be the Home tab. So once the Assessment tab generates, you do have the option to complete that tab. It's not a requirement, so if you do have the information, we strongly urge you to complete that. If not, you can move on to the next tab. Once you get to the Home tab that is required, you need to just check the boxes that apply to your particular request. And once you've checked off those boxes, you will go ahead and click on Continue, and then move on to the next tab. So the only tabs that you do need to complete that are required are going to be your Start tab, your DX code/items, and your Home tab. The other tabs you are able to complete, but they are not required for your submission. The last tab is going to be your Summary tab. This is where you can enter any additional information that would be deemed pertinent to the review that's not already included in the information that you've provided or that's provided in the documentation that you're required to submit. If you do enter information into this box, we ask that you do not copy and paste information, because sometimes the special characters or spaces will give an error to EQ Suite once you click on the Submit button. This is not a required tab for you to complete, so if you do not have anything additional that you wish to add, you can leave that information blank. Once you're ready to submit the review, then you will go ahead and click on Submit for Review. and then the system will let you know that it's been successfully submitted and give you a review ID number. Once the review ID number has generated, we would advise to go ahead and jot that information down, because once there's any updates to the review, you will receive an email notification letting you know. Once you've gotten your review ID number, the next step will be to link your attachments. When you click on this button, you will be prompted to either print an attachment cover sheet to fax over the required documentation, or you can upload the documentation via EQ Suite. If you click on the print attachment cover sheet, you just need to make sure that you check the box that says supporting documentation, and then you will click on generate cover sheet. You do want to make sure that you do not have any pop-up blockers enabled on your computer, or the barcoded cover sheet will not generate. If you choose to upload the images from your computer, then you will click on Upload Attachment Images, and then you'll simply click on the Browse button to find where the document is saved on your computer, and once you find that document, then you will click Upload. Once you click on Upload, the system will let you know that the document was successfully uploaded, and then the review will move to Nurse Review for further processing. This concludes our video tutorial on how to enter a review for long-term home health services.